Good morning to you and to all those who tune in every morning. We start our briefing giving our condolences to the relatives and friends of two people who died due to COVID-19 yesterday. One is an 85-year-old patient from the municipality of Nicaragua from the Villa Clara province with a history of several related diseases who had been admitted since last April 17, who was in critical and unstable condition. And we have been reporting on his status in the last few days. He was admitted at the Celestino Hernandez Hospital of this province. He had spent 4 days in the intensive care ward, and despite all efforts and treatments, he passed away. The other patient who died yesterday is a 63-year-old patient from Santiago de Cuba municipality with a history of chronic psychiatric disease, who had been admitted at the Gustavo Machin Psychiatric Hospital of this province. He developed some respiratory symptoms and was transferred to the Ambrosio Grillo Hospital, one of the facilities in this city devoted to the care of this pathology. And although he first tested negative, his condition worsened, and ultimately he died. As he had respiratory symptoms, a new test was repeated with a sample taken from his lungs, and it tested positive to COVID-19. So these are the two fatalities that we have to inform today. The Cuban healthcare system does its best, but regrettably, some cases cannot be spared. There are 12 persons currently at our intensive care units. 7 are reported in critical conditions, 1 more than those reported yesterday, and 5 in serious condition. In our country, the situation remains similar in terms of the presence of visitors, 11,530 of which 6,759 are Cubans who reside abroad, and 4,700 are foreigners. In rental houses, there are no changes. There are 946 foreigners in the municipalities that we have mentioned every day. The number of patients admitted to our hospitals, we now have 3,330. 53 patients are under surveillance, 2,475 are suspected cases, and 802 are confirmed cases. At the primary healthcare level, we have 6,742 under observation. To detect the presence of SARS-CoV-2 virus and of the COVID-19 disease, yesterday our laboratories processed 1,859 samples from different patients. At the laboratory of the Pedro Curie Tropical Medicine Institute, 580 samples were studied. In Santiago de Cuba Molecular Biology Laboratory, 383. At the Brothers Ameijeras Laboratory, 377. At Villa Clara Laboratory, 329. 188 at the Provincial Laboratory in Havana, and as a result of these tests, 48 samples tested positive yesterday. for a point 2.6 of the samples studied, a higher number than the one that were reported yesterday. At this moment, Cuba already accumulates 43,508 samples, and 1,437 have tested positive. This represents the 3.3% of the processed samples. Of the 48 new cases confirmed, all were Cubans. 33, that is 68.7% of them, were contacts of confirmed cases, and 15, that is 31.2%, the source of infection could not be traced. Of the 48, 24 are female and 24 are male, and 58.3%, that is 28 people, did not show any symptoms of the disease. And we reiterate the importance of the screening, which we are working on a daily basis. Of the total diagnosed cases, 26 are from the province of Havana, scattered in 11 municipalities. The age group of those who tested positive is as follows. Younger than 1 year old, there was none. From 1 to 19 years of age, there were 7. The largest number was in the age group between 20 and 29 years, with 15 cases. From 40 to 59 years, there were 14, and from 60 years and above, there were 12 confirmed cases yesterday. When taking a look at the infection rate per 100,000 inhabitants, the special municipality of the Isle of Youth remains with a positive rate of 46.4 per 100,000 inhabitants, followed by Havana with 28.4 per 100,000 inhabitants, Villa Clara with 24.3, Ciego de Ávila 18.7, Matanzas 14.8, Santi Espíritus 13.1, Mayabeque 11.7, Pinar del Río 8.6, Holguin 8.2, Artemisa 6 per 100,000 inhabitants, and the remainder of the provinces are below 6 per 100,000 inhabitants. Of the 1,437 patients diagnosed with COVID-19, 790 show a stable clinical evolution. That is, 55% of the patients who are hospitalized who have tested positive. As I said earlier, we grieve the cumulative loss of 58 people, which represents a lethality of our country of 4%. We have the 2 evacuees that we always mention, and 575 people who have been discharged from hospitals, 50 people more than yesterday. This represents 40% of all the patients diagnosed on the island. This is the situation we have to report about our country. Although we are dissatisfied with our lethality rate, because we work very hard not to lose any patient. Despite the associated pathologies they may represent, we can say that in the region of the Americas, the average lethality is of 5.56%, and there are 12 countries whose lethality is higher than that. That's 5.56%. Turning now to the international situation. The number of countries reporting transmission of the disease remained the same. 183 countries with the addition yesterday of Western Sahara. There is a total of 2,916,500 confirmed cases, 71,795 more than the day before. In terms of the death toll, 4,608 died yesterday, for a cumulative total of 205,923 fatalities, for a lethality of 7.06%. The region of the Americas confirms 1,182,433 cases, 47,747 more than yesterday. This accounts for 4.5% of the numbers of cases in the world. And regrettably, the region also accumulates 65,752 fatalities, 2,103 deaths more than the day before, for a lethality of 5.56%. This is the situation of Cuba and of the world that we had to offer to our population.